And also, we kindly ask that as the presentation is going on, you kindly type in your questions into the chat box. We will address every question, concern, clarification, and suggestion during the Q&A item. I will be monitoring for questions at that time, so you can raise your hand, or you can, and we'll call you, or you can type it in the chat box. But during Tony's session, I kindly ask that you just type it in till we get to the Q&A. I believe that will be pretty much everything, and I'll be happy to hand it over to Tony. Nice meeting you all.
Great. Well, welcome to the applicant orientation session. And thank you, Cheryl, for your help. And thank you, Robert. This is new for us. We've done this in person in the past, but now we're in the new high-tech world. So I'm going to try to move as quickly as I can. So here, can you all see the screen that I'm sharing? Oops, shouldn't have clicked on that. Okay, so this is the agenda. We're going to start with an overview of the HUD competition. Then we're going into the local process, timeline, and local applications and scoring. Then we will have the breakout session. As Cheryl said, if you could hold your questions until then, but you can send them via chat anytime. And then we'll have a special training on matching requirements. And finally, we'll have a YHDP breakout session. So if you're not a YHDP agency, you should feel free to leave then. So I'm going to, the focus here is on the Continuum of Care competition. I know you're here because you're either going to apply for Continuum of Care funds or are interested in doing, or exploring the possibility of it. So I have a document here, which is our Continuum of Care policies and procedures document, which gives you all the information that you need to know to apply for funds. And in addition to this, all of the materials are posted on the Homeless Action Partnership website under funding opportunities, Continuum of Care, HUD Continuum of Care competition. So I'm going to talk from this document. I'll try to move as quickly as I can. I'm going to start on page 3 here to talk about the funding that's available. So in Santa Cruz County, we have the possibility to apply for about $5.3 or $4 million. We've gone up every year. It's great. This includes $4.8 million in annual renewals. That's the amount needed to renew existing projects that have already received CoC funds for 1 year. And that amount, the annual renewal demand, includes expiring Continuum of Care grants at $3.5 million and expiring YHDP grants at $1.2 million. So this expiring CoC grants can also be reallocated, and then YHDP grants can be replaced. So we'll talk more about that. And then we've also got the possibility of a new project bonus for $242,000, which seeks new projects, which are permanent supportive housing, rapid rehousing, joint transitional housing and rapid rehousing, which is a new program type we'll talk about, coordinated entry, and dedicated HMIS projects. Then we have a domestic violence bonus, which is worth $149,000. And we can apply for rapid rehousing projects targeted 100% to persons, surviving domestic violence, transitional and rapid rehousing, and then coordinated entry focused on domestic violence. Now, from here, I'm going to jump to page 30 on the document to give you a sense of what the timeline is for the application process, since that's what you're interested in doing. HUD released the NOFA, or actually it's called NOFO this year. They changed the name, Notice of Funding Opportunity. They released the NOFO August 19th. We sent out a public solicitation of applications September 1st. It's September 10th today with the virtual applicant orientation session. And then applications from you guys are going to be due October 13th, 2021 by 5 p.m. That's the deadline to submit local supplemental applications, which we use to review and rate applications locally for inclusion in our application. And then also the HUD application, which you submit via HUD's online electronic grant management system called eSNAPS. So you'll be submitting both of those by October 13th. And I should point out now that YHDP renewal projects are not competitive this year, so they don't need to submit the local supplemental application because we're not going to be rating and ranking them. But you do need to submit the HUD eSNAPS application because you still have to apply to HUD. And then the YHD replacement projects, again, we'll talk more about that, do need to submit the local request for approval form, and which is, a one-page form that we have for you, and also the eSNAPS application. So the HAT board is going to meet October 22nd, at which point they'll approve or reject, rank, and place into tiers all the projects received. Decisions will be sent out to all the applicants. We'll have a brief appeals period. You can look at the dates there. Very importantly, there's an item there called technical review, November 1st through the 9th, 2021. That's the time when I'm going to be reading all of your eSNAPS applications with a very fine eye for technical correctness and for eligibility and to make sure the applicant flows well and is in line with our application. It's a very important step to make sure that we get funded. So you'll have to have somebody standing by to make the changes that I suggest at that time. And then finally, we'll submit the application by the HUD deadline November 16th, and that's something we do centrally as the CoC. You will have already submitted your project applications, and then we'll send the whole consolidated application on to HUD. So let me jump back to page 5. And I want to talk a little bit about what's new in this year's NOFA. Many of you have been part of this, so you're interested in what's new. So I've already mentioned, YHDP projects are being renewed non-competitively. That's new. And also, YHDP recipients may replace their projects with new projects more suited to address youth needs. So this is something that we want to talk about during the YHDP breakout at the end of this session. Then, skipping to 3, Housing First is required for all projects this year. 4, there's an emphasis this year on collaboration with housing authorities, especially around American Rescue Plan vouchers and homeless preferences. There's an emphasis on racial equity factors, and there's an emphasis on working with people, to end unsheltered homelessness. And then there are bonus points this year in the application if we put forward at least one new project that it includes housing subsidies that are non-CoC and healthcare services that are non-CoC funded. So we're really looking for a project like that to get those 10 bonus points. And then very briefly, HUD's homeless policy and program priorities. It's important to follow those because they sort of suffuse all of the application materials. They change a little bit every year. So very briefly, ending homelessness for all populations, using a housing first approach, reducing unsheltered homelessness, improving system performance, and partnering with housing, health, and service agencies, and then racial equity, and then in working with people with lived experience. Those are HUD's priorities this year. I wanted to talk very briefly about who can be served, especially for those of you who are new. The program serves people who are homeless under HUD's final rule on the definition of homelessness under the Hearth Act, which is posted on HUD's website. It has four major components. There's people who are living in places not meant for human habitation, in emergency shelter, in transitional housing, or who are exiting an institution where they temporarily resided. That's an important category, category one. Category two is people who are at imminent risk of homelessness, who are losing their primary nighttime residence, which might be a motel or a hotel or doubled up situation within 14 days. And there's some more detail about what that means. Category three generally doesn't apply, so I'm not going to talk about it at this point. Usually, it's only in unusual circumstances that you can use a non-HUD definition of homelessness under category three. Then category four is people who are fleeing or attempting to flee domestic violence, dating violence, sexual assault, stalking, and other dangerous or life-threatening situations, for example, human trafficking. And I'm just going to shorten that to DV or domestic violence. That's all a mouthful from here on out. So that's the population that we're talking about. So I'm going to move down to I'm going to skip over some sections, the eligible project applications, which is essentially nonprofits and governments, and the general CoC project types and eligible cost categories. Most of you know what these are, and so we can talk more about, if you have questions about how you want to structure the costs in your project, I can talk with you, like supportive services, what are eligible categories, operating costs, and so on, administration. So I really wanted to focus on, at this point now, on your CoC renewal applications. So you are eligible to apply for renewal funding this year if your projects are expiring in calendar year 2022. And we do happen to have a handy list of projects which are eligible right now. This is it right here. This you'll find posted on the website. This is a list of all of our renewal projects and the amounts they can apply for. I hope you can all see this. It's kind of small print. If you have any questions about whether you are eligible to apply for renewal, let me know. So the only applicant that can apply for renewal is the applicant named in that list. It's the same entity that has the expiring grant agreement with HUD. And what you renew are what are called term activities. Those are things that recur every year, like leasing, rental assistance, operations, services, HMIS, and admin. You cannot renew acquisition or construction funds because those are one time. You can only renew for the exact amount that was on that list, the exact amount of your previous grant. But you should know that even though that's what you apply for, what was on your previous grant, you might get more money or actually less, depending upon changes in the FMR between the time that you apply and the time that you get the funds. The FMR means fair market rate for rentals in our area. And traditionally, our FMRs have only gone up. And all renewal grants have to apply for only 1 year. So I'm going to move down and talk about consolidating renewal projects. So HUD allows applicants who have more than one project of the same type, like, for example, permanent supportive housing or rapid rehousing. If they may have 2 or 3 grants of the same type, they allow you to consolidate actually up to 10 of those, same project types into a single project application. So again, to be eligible, you have to be the same recipient and it has to be for the same component. And to apply to consolidate, what you have to do is submit your separate applications, and also then submit, like another application, which is the combined application. So you have to submit the separate applications because they get ranked. So if one of them gets, if both projects get funded, then the consolidated project you will automatically get the consolidated project. But if one project gets funded and the other does not, then you don't get the consolidated application, but you just get the one project funded. So that's why it's a little convoluted. YHDP renewals. We have YHDP, every single YHDP project is renewing this year. They are not eligible to consolidate with non-YHDP projects. But if you happen to have 2 YHDP projects of the same type, they could consolidate. So I'm going to keep going down. Again, there's more information like about threshold requirements. You can read this document. You can download it from the website. But I want to focus on creating new projects now. So in 2021, there are several ways we can create new projects in Santa Cruz County. One is through reallocation, which means that that we review renewal projects, and the HAP board makes the decision that that maybe because of performance issues or because it would be a better use of funds, they decide to reallocate funding, some or all of the funds from one or more renewals to one or more new projects. So, they could reallocate from a low performing project to a new proposal that somebody puts forward. And then the second is through the CoC bonus. The third is we could actually have a project which combines the CoC bonus amount plus additional funds through reallocation. And then fourth is the domestic violence bonus, and fifth is YHDP replacement. So new projects can typically request grant terms for a variety number of years, 1 or more years depending on the project type. But our policy in Santa Cruz County is to have new projects apply for 1 year of funding. That's because that maximizes funding in the future. So if you had a 1-year renewal of $100,000, if you reallocate that to a new project, if it applies for 1 year, it gets $100,000 per year. But if it applies for 3 years, it gets only $33,000 per year. So over time, that's a lot less money. So that's why we have a 1-year policy for new projects. So there are a couple types of new projects. Most of them are just standalone new projects. It would be like a new thing that you're trying to do. Another might be an expansion project. So this is a new project application where you apply saying that I'm actually expanding this other renewal project. And I want more money because I'm going to increase the number served, or the beds or units provided, or the services provided, or the HMIS services provided. And the way you do this is you submit a new expansion application, but also you submit the renewal application. And if both of them get funded, then HUD will just issue one grant for the amount of both the renewal and the expansion. And YHDP projects are not eligible for the expansion processes this year. Domestic violence bonus projects can be created through the expansion process, including expanding an existing previous DV bonus project, but also by expanding a non-DV project, as long as the expanded portion is 100% targeted for DV. Then there's something called the transition grant option. HUD allows grantees to transition their projects from one component to another. We've used it in the past to transition transitional housing projects to rapid rehousing, or rapid rehousing to permanent supportive housing. To create this, the CoC has to eliminate the original renewal grant and put this transition grant in its place. And no more than 50% of the funds can be used for the old component, and at least 50% have to be used for the new component as the project transitions over to the new thing, say rapid rehousing. So I wanted to talk a bit more about the new reallocation and new CoC bonus projects. How am I doing for time, by the way? Does anyone?
You're looking good.
Okay, great. So there are some types of projects that are eligible for reallocation or the CoC bonus as new projects. The bonus again, 242,000. So we can create one or more projects with the bonus and with renewal funds that include, they could be permanent supportive housing projects that will serve chronically homeless persons, or what's called the dedicated plus population, which basically means almost chronically homeless. There are some criteria for that. And then there's the rapid rehousing projects. There's transitional housing and rapid rehousing projects. It's a combined project type. There are coordinated entry projects and HMIS projects. Those are all the projects types that can be created through reallocation and bonus. The domestic violence bonus, again, there's a national set aside of $102 million for the DV bonus competition. It's a little bit different from the CoC bonus process. This is for projects that serve a 100% DV population. Our bonus possibility is 149,000. The minimum single application amount is 50,000. They don't want anything smaller than that. The DV bonus project can be an expansion of a non-DV renewal, as I said. And there are 3 project types. Rapid rehousing, which follows the housing first approach. Transitional housing / rapid rehousing, again, housing first. And then coordinated entry focused on DV priorities which is trauma-informed and client-centered. No more than one of those projects can be created. So it's competitively scored nationally. HUD's going to look at our overall CoC score. They're going to read the section of our CoC scoring narrative, where we talk about the need for domestic violence resources. And then they're going to look at the quality of the project applicant and the description we provide about the DV provider for up to 25 points. So HUD will rate and rank all of the bonus projects nationally. So but meanwhile, we have to rank the DV bonus project locally. So if HUD selects the bonus project, then they'll remove it for the DV bonus. They'll remove it from our priority listing, which is rank. Imagine a list of all of our projects in rank order, with the highest scoring being the first chosen to the lowest scoring being the last chosen. So If they fund the bonus project because it's scored high, if they fund it with the bonus funds, they will remove it from our listing, and all the projects ranked below it will slide up one rank and therefore have a better chance of being funded. But if they do not select the project for the bonus, they will leave it on our listing, and the project might still get selected as a regular CoC bonus new project, which could, but that affects the projects that are ranked below it. So that's the DV bonus. YHDP replacement projects is something brand new this year. Applicants who are YHDP applicants already, they may opt to replace their current project with a new project. This is so that they haven't had this possibility to replace a project with something that would work better in the past. They've had to continue with what they've had. So they can do this now. All they have to do is submit a new replacement project. It can include activities that would be ineligible under the CoC program. It can retain parts of the old program. It's intended to be very innovative. It has to just be a better way to address youth homelessness, and it has to be approved by the CoC. So there are various eligible types. You can see here on the list, I'm not going to read down it. One of them is host homes and kinship care and other innovative project types. We're going to talk more about this when we get to the YHDP breakout. So I'm going to move on. Couple of things about them, though. They cannot request capital costs, so that's not happening. No construction, acquisition, or rehab. And there's a long list of special program flexibilities we will talk about later today. So here's a summary table of all the types of new projects that are possible. And then here we go through some of the threshold requirements for new projects. It's important that you meet the threshold requirements. So if you have any doubt about that, we should talk. I've got some sections here that are more about all of the things that I've talked about, more details, like more about reallocation, how it works, more about the bonus funds, the types of, how the grant funds might be used. I'm not going to go into detail here. You can read the document. It's like the terms for rapid rehousing programs, how long the assistance can be for, and so on. How joint transitional housing and rapid rehousing bonus projects work, HMIS bonus, coordinated entry bonus, and more about how the transitional grant project works and about expansion process, which we've talked about, and about replacement projects. All this text on replacement projects we'll be talking about later. So there's a lot there. And here's a section which will help you design your new projects, design and implement them, all about your funding levels and timeliness and grant terms, which again, we want you to apply for 1 year. Then the match requirements. So CoC funds have a 25% cash or in-kind match requirement. With the exception of leasing funds. If you have leasing funds, you subtract those from the calculation. We have a match training a little later in this this orientation, so I'm not going to talk about this right now. We'll talk more about all of this in just a little bit. As I alluded to before, eSNAPs, the electronic application process. So this is a two-part application, as I said before. One is you're submitting a local supplemental application for the purposes of getting your project rated and ranked by our HAT board, and then selected to put on in our application to HUD. And then the second part is the actual eSNAPs application, which gets submitted to HUD. So you're completing both simultaneously. And actually, with the local applications, I tried to make as much of the information match the eSNAPS application so that you're not having to write a bunch of new text. You're able to actually cut and paste between the two application types because the questions are the same to the extent we could do it, but not entirely. So, when you go to apply for eSNAPS, you'll have to register with eSNAPS. And when you go in there, you should rely on HUD's very detailed eSNAPS materials as authority, the authority on how to use eSNAPS. I can provide you with technical assistance, but that's because I've read those eSNAPS training materials that HUD provides, and I can walk you through them. So, but I'm happy to help you. But first, try to read the materials before you ask me a question. So, all the information is available on the HUD Exchange. The eSNAPS portal can be accessed here at esnaps.hud.gov. Again, all of this information will be posted, so you'll be able to find it. What you're essentially doing with an eSNAPS application is you're creating a user profile, and then you're creating a project applicant profile, and then you're creating a project application. So, and it's the project application that gets submitted to HUD. To apply, you have to have a valid DUNS number and an up-to-date federal contractor registration. It used to be called the SAM registration. So if you don't have those, you should start on that right away. Again, contact me if you have questions. So I'm going to move into our local process, because up until now I've been talking about all, the HUD NOFO and all the HUD requirements and eSNAPs and everything. So I want to talk about our local homeless action partnership process for, selecting projects. So, if you want to apply for funds, you have to participate in our local process. HUD expects that. You can't just apply to HUD. HUD wants our continuum of care to coordinate the whole process. And so that's what we're doing. We have, so our continuum of care has identified particular project types that we're encouraging you to apply for, which are pretty much in line with, those HUD project types that I talked about before. So we are encouraging all renewal projects to apply in CoC and YHDP, especially if you're high performing and are still an effective use of funds. Now, if your renewals are not high performing and an effective use of funds, then it's likely you'd be looking at funds being reallocated. So reallocation proposals. We're interested in voluntary reallocation of any transitional housing projects to new permanent supportive housing projects, or new rapid rehousing projects, or joint transitional and rapid rehousing, or coordinated entry, or HMIS. Those projects, would be expansion projects, coordinated entry, or HMIS, if there's unmet operational need or if there's some need to improve their administrative efficiency. So the type of PSH projects we're looking for are targeted to chronically homeless or dedicated plus, but in all cases, we want projects which are trying to serve people with the longest histories of homelessness and most severe needs, as identified through our coordinated entry assessment process in the VI-SPDAT tool. So we're also looking for other proposals for reallocation for anyone who's interested in applying for permanent supportive housing, again, for those same populations, or joint, all the same project types. We would encourage, if needed, proposals for expansion of coordinated entry or HMIS. And then for continuum of care bonus proposals, all of the same project types that I just mentioned. For DV bonus proposals, we're encouraging all of the eligible types, which are rapid rehousing, joint transitional, and rapid rehousing, and coordinated entry. For YHDP replacement proposals, we encourage, I mean, we're not, if the YHDP thinks it needs to replace, the initiative as a group thinks it needs to replace particular projects, then we encourage them, as long as they're eligible YHDP replacement project types, and you can make a good case that it's a better use of the funds. So, so now I'm just moving down. We wanted to make sure everyone knows that that there's a possibility of reallocation. We have had a policy of encouraging voluntary reallocations to better align with our CoC. What this means is that like I'll read it. In order to encourage projects to voluntarily align themselves with our strategic plan, existing transitional housing projects or other projects that are no longer needed or that no longer match your agency mission or that are underperforming or wishing to convert to a new project type, we will give you priority in accessing those funds, those reallocated funds, if you do it voluntarily. I mean, we can reallocate non-voluntarily too, but we have wanted to encourage, the reallocation of, lower performing projects or projects that don't work well. So that's important to know. Here's some stuff about how we're going to look at victim service providers for the DV bonus, their use of comparable database. Victim service providers are prohibited from using HMIS. Rather, they're required to use a comparable database that meets the HMIS requirements. All other projects for continuum of care funds, whether they're new or renewal, are required to enter client data into our HMIS system, which is called Clarity, and it's managed by our contractor BitFocus. So the DV projects, how they address safety needs. So that's what we're looking at. We have, I'm going to talk about our basic, process steps. We've sent out a notice of funding with the application timeline and the criteria for rating and ranking projects, which includes performance measures. We are holding this applicant orientation, which is called here technical assistance session, so that you all can learn about the requirements and learn how to apply. I'm available for ongoing technical assistance. If you just email me, I will answer your questions, and you'll also find information posted on the HAB webpage. Then we're requiring local project applications for rating and ranking purposes, as well as the eSNAPS applications. The board's going to meet and approve or reject, score, rank, and place into tier 1 and tier 2, all renewal and new projects. Then, there's a notice and appeals process, and then, final submission of the application. The HAT board will use rating and ranking criteria. They will rate and rank projects based upon publicly announced criteria. They will engage in a process which is non-conflicted. Only members who lack a conflict of interest will participate. All members who review the projects will, they do have knowledge of the community and homelessness issues, and they're representative of varied sector interests. I'm not going to go into right now who's on the HAP board. You can look on our HAP webpage if you want to see that. They will sign the conflict of interest policy and recuse themselves if they have any possibility of a conflict. They'll review and rate the projects. They will look at performance data. We may have a proposal question and answer session. That's something we haven't decided yet, so you should stand by to find out if we want to have a meeting with you to talk about your, to allow the board to ask you questions about your project. We will let you know if that happens. It's uncertain. Then they'll talk about the projects in the larger context, and then they'll vote on approval or rejection, the rank order, and the tier placement of each new and renewal project, including bonus projects. And then you'll receive notice of the decisions. So that's how the process is going to work. Again, on-call technical assistance. Here's my email address. So I'm going to move on now. So here are some resources. On this document, there's a lot, pretty much most of what you need to know, like places to go. The HUD Continuum of Care NoFo competition page. There's a link for the actual NoFo itself. I suggest that you read the Continuum of Care Notice of Funding Opportunity document to get more detail about the things that I'm talking about here in HUD's own words. And just going down this list, there's the link on number 11 for eSnaps, and then number 13 for the HAP webpage. So this document has some attachments. I'm going to go straight to number 2 because we've already looked at number 1. Number 2 is the local project rating and scoring criteria that the HAP board will use to rate your projects. 100 points possible. So we've kind of retooled this year to be almost completely auto-scored. So housing project type, 10 points out of 100. Certain projects like permanent supportive housing, rapid rehousing, coordinated entry, and HMIS get 10 points if they serve the right populations. Or new projects, DV project types getting 10 points, and then 5 points for transitional housing projects or permanent supportive housing projects, which are not dedicated to chronically homeless or dedicated plus populations. And then 0 points for some project types. I'm not going to go list these in detail because you can see them. So if I'm going too fast, you can ask questions later or read the document. So the second scoring area is populations served. We're prioritizing the chronic homeless population or DV population especially for the bonus, 10 points. And it's a sliding scale, as you can see here, 10 points for serving the target population, the prioritized population, and 100%. If you serve that population less than 100%, you would get fewer points. And you will identify that amount in your application. Then the third section is performance measures. We've got renewal-only performance measures and new project-only program design measures. This category is 20 points possible. So for renewals only, we're going to use HMIS data generated in the form of an APR report for July 1st, 2020 to June 30th, 2021. Or if you're a DV project, it would be generated from your comparable database to assess your performance in a number of performance areas. And what's different this year is in past years, we've used your APRs, which all have different grant years. This year, we're just going to use a standard year for every project, July 1st through June 30th, to be more comparable across the board. So the housing stability points are 7. The income points are 5 or 2.5 points per question. Then non-cash mainstream benefits, 2 points. Program occupancy, which is otherwise known as bed utilization, would be worth 2 points for at least 90%. Returns to homelessness, no more than 20%, 2 points. Length of stay, we're wanting increased lengths of stay for permanent housing projects, decreased for transitional and rapid rehousing projects, worth 2 points. And then there's a question for victim service providers only, which is not scored. This, new projects do not have HMIS data, so we can't look at their performance measures. So instead, we look at the program design and score that for 20 points. So if you've got a new housing project, we're going to be looking at your program goals, where your participants will come from, whether it's the streets or other housing, your outreach plan, the types and frequency of services you will provide, how you will help participants to obtain and remain in permanent housing, how you will help participants to increase their employment and income and live independently. And then for victim service providers, what is your plan to increase the safety of participants? And then also, do you have a feasible plan to implement a housing first strategy? So I will skip over coordinated entry, new coordinated entry projects or new HMIS projects. If anyone wants to talk with me about that, I'll be available. So the next scoring area is program effectiveness. Now this is both new and renewal. So coordinated entry participation is a major area. We want to see that at least 90% or 95% of your clients come from SmartPath, of your new clients. That's as a sign of effectiveness. The second area of effectiveness is your fidelity to housing first. So we have some questions here, and the more yes responses you provide, the more points you will get. So we're looking for things like, we don't want you to we do want you to prioritize clients who have been homeless longer and who are more vulnerable. We want you to accept clients whether or not they have a substance use history, or whether or not they have mental health symptoms, or we want you to accept them if they have a criminal history. We want you to accept them even if they have no income or financial resources. And we want you to use a harm reduction model. And we also want, we don't want you to have barriers to entry to your program, like minimum income, or must be employed, or must have a state ID, and so on. So this is our Housing First Fidelity assessment. And the more yeses you answer, the higher the score you get. Financial and cost effectiveness, this is again going to be worth 10 points. We're going to look at housing versus services funding. So the more of the HUD funds you request that are for housing activities, such as leasing, rental assistance, or housing operations, the more points you'll get. So like if you're 100% housing activities, you'll be fine. Now, if you're using a lot of funds for supportive services, you'll get lower points because it's not as an effective use of funds. Then we also, for renewal projects only, not new projects, we're also going to look at drawdown completeness in your most recent completed program year. So if last year you drew down 100% of the funds that HUD awarded you, you'll get the full points. But if you did not draw down all of the funds, then you will lose some points. Then we're going to look at agency experience and capacity. It's going to be a sliding scale for agency experience based on the number of years you have implementing the proposed program or a similar program type. Then capacity issues. we will deduct points if in the past year HUD has disencumbered funds, you have unresolved HUD monitoring findings, or if you've submitted your APR late. Then mainstream resources, you'll identify which strategies you use to help clients access mainstream benefits to which they might be eligible, and you'll get more points for more strategies that you use. Number 8 is a new category, equity factors, which again is a big HUD emphasis this year. So we're going to ask you a series of questions to assess how your agency is doing with equity. So we want you to check off each factor that your agency has already implemented or we're allowing you to commit to implement within 1 year. So within agency leadership, governance, and policies, a point for if you have underrepresented individuals, whether BIPOC, LGBTQ, et cetera, in managerial or leadership positions. 1 point if your board of directors has a person with lived experience. 1 point for if you have a process for receiving and incorporating feedback from persons with lived experience. 1 point for if you have reviewed your internal policies and procedures with an equity lens and have a plan for developing and implementing equitable policies. And then program participant outcomes. Have you looked at your program with an equity lens, and have you identified programmatic changes to remove barriers to clients' access, participant outcomes to be more equitable? So, and are you working with HMIS to develop a report that disaggregates your data based upon race, ethnicity, gender identity, and age? So those are factors. And then finally, we have community collaboration and participation. This is 3 points. If you attend all HAP membership meetings, and if all of your programs participate in HMIS, then you'll get full points here. But if that's not true, then you'll get part points. So then to help you out here, we have the scoring tool that we will use to look at it, renewal project. So this is just another take on all of those criteria that we just looked at, but actually in a more handy, easy to use format. So you can see how we're going to go down and score your projects, like you've got here, like the housing stability, the income, these are performance measures for then the program effectiveness points and so on, just down the list. And then here's the new project scoring tool. So, which is a little different. So then finally, we have here the local application instructions and checklists. So number 1, the local project application is due Wednesday, October 13th. Send it via email to housingforhealth@santacruzcounty.us and to Tony Gardner Consulting at yahoo.com. We don't want paper copies, just email us your application, which should include the completed local application form for your project type, whether it's renewal, new, or YHDP replacement. And there are some attachments that go with it, you'll see here. One of them I'll note, it's like your most recent APR, any monitoring findings from HUD, your most recent audit. But if you do client surveys or focus groups, if you could attach a summary of those, we would appreciate it. And then match letters if you have them, but you don't need to attach them, but you do have to have them available if HUD asks for them. And then number 2, the HUD electronic eSNAPS application. Now we want you to submit the draft by October 13th. Submit it in eSNAPS, and that includes the whole project application and everything that goes with it. All right, so I wanted to look at the renewal application form. How am I on time now?
Okay, you're looking good. But we want to be mindful of the time so we can have enough time for questions and answers.
Okay,
Okay.
so I'm just going to go very quickly through the local application form. So here's the renewal application. We want it in 10-point font, New Times Roman. The first page is basic information about your application, non-scoring information like your applicant name and project name, a brief description of the project, and then information that comes basically directly from eSNAPS, which is your how many people you will serve of different population types, the percentage of subpopulation types, a listing of the supportive services that your project will provide, a basic simple budget for the HUD funds and cash match, for rental assistance, if you have rental assistance, a worksheet to calculate that, and then your total of match commitments right there. So that's just basically one page of information. And then comes your scoring questions. Here you have your housing and project type. It's really, you just check off the right one. Priority populations, check off. Performance measures, you enter the percentage for each performance measure. And at the end, we give you a handy worksheet for calculating the each measure, like housing stability here. It's which is basically the number, you use the APR question 22A1, the number of program participants, and you have the total number of leavers and stayers who have stayed in permanent housing for more than 180 days. And then you come up with the percentage who have stayed for more than 181 days, which is the percent. So you make this little calculation, and then you enter that information right up here, the percentage. And you do that similar calculation for all of these measures. So here's the fidelity assessment and so on. So because we don't have a lot of time, I'm not going to talk more about how this application works, but it's as simple as we can make it. The new project application is very similar, except for it has program design instead of program performance measures. And again, that's because you don't have HMIS data yet. So there are a series of questions to answer for program design. Then we have, if you're wanting to submit a YHDP replacement project, we're asking you to give us a 1-page, or well, actually it'll be 2 pages, request for, HAT board approval. It's pretty much, if the YHDP initiative wants it, you'll get approved, but we want to know what it is. So you answer some basic questions about the replacement project, which are all here. And the most important of which is number 6, the replacement project description. We want you to tell us in no more than 1 page, how what the project is and how it differs from your previous project, any NOFA exceptions that you're requesting, the reason why you're replacing your existing project, any waivers or special activities you're going to use, best practices, numerical outcomes, and how this the replacement project would meet the goals of our YHDP plan. So with that, I'm going to give it a pause. It's time for questions and answers. So I'm going to exit my Am I no longer sharing?
You are still sharing.
Okay, stop sharing. All right. Am I still sharing?
No, you're good.
Okay, let's go with the questions then. And
Okay.
Cheryl, I guess you've got some questions from the chat you've been looking at, and then also people can raise their hands.
Okay. So I do not have any questions right now on the chat.
Okay.
We're just encouraging our guests to kindly raise their hand or type in their question. I have just put in some information for everyone, the Housing for Health email address, your email address, and also the link to access all the application materials as discussed today. So we'd like to open the floor for any questions. You can just raise your hand. I'll see it. Or okay, Robert.
Yeah, not a question, more of a comment to everybody. This, from my perspective, this annual HUD ritual is a chance for us to look at how can we bring in the most resources possible for our community to address homelessness. So I hope that you all get a chance to process what Tony went through and really think about, are there ways to make changes to our full package through partnerships between agencies or looking at other opportunities. And I'll just give one example that has just really stood out for me. The way that HUD funds us is that if we have a project that is using HUD dollars for housing related expenses tied to rent, the grant dollars go up every year. If we're using HUD dollars for services, they stay the same forever. So as costs go up in our society, we're stuck with a fixed grant. So HUD has intentionally really built an incentive for us locally to figure out how do we find other ways to cover services from other sources and use HUD money to pay for housing costs. So every year we have a chance to try to jigger our whole package to bring in more money. And that's one of the major ways, is if we can start to move money more towards housing over time, it results in a bigger package for us and helps us to address, I think, a really core central part of why we have so much homelessness, the gap between what people have in income and the cost of housing. So the other thing I wanted to say with YHDP, we're going to have a meeting next week and we'll have a specific YHDP check-in time today. But there's opportunities to really reflect on how well all of our youth homelessness demonstration projects have been going. There's a state funding opportunity. So these moments don't kind of come around very often, but I hope we really get creative and think about what's going to be best for our community as a whole. And I also know that there was a lot of information that Tony just went through, and people maybe need to digest it to get questions, but I think if there are questions now, we definitely want to hear them.
Thanks, Robert.
If you have no questions, then we'll be out of here sooner. But we really do want questions. So.
Okay, there's still nothing in the chat box. So I guess our folks are still digesting all that information.
Yeah.
And will let us know.
While we're waiting, I'm going to see if I can show people where to find the materials on the webpage. So here, this, can you all see this? Okay, so here is the Homeless Action Partnership webpage. This is not the entry page, but if you go to For Providers Funding Opportunity, then you'll come here. And if you scroll down, you'll pass some other funding opportunities and you will see federal HUD Continuum of Care. So all the information you will need is here. at least for the local process. You'll have to go to HUD's webpage for the eSNAP stuff. But so like all of the materials that I've been walking through today, they're all posted here. You can download them yourself. And we'll be adding additional materials as we create them. Okay.
Tony, I'm wondering if you could just repeat the, I want to lift up the new project opportunities, maybe just high level. What are the new project opportunities?
Yeah. All right. So I think I can do that by let's see, going back to this document. So new project opportunities page, did I have that on 13?
Yeah.
So we would like to see new projects. I mean, we encourage new projects, especially if they will make our continuum of care better. You can, and so the new project types, just to talk a bit more about them, do you have an idea for a permanent supportive housing project that targets chronically homeless people or the dedicated plus population? If you do, I mean, if you're really interested in serving the longest term homeless and those with highest barriers, we want to see that project. And we would encourage it. And especially, as Robert was saying, if it has, if it uses, HUD funds for housing activities and uses mainstream resources for the critically needed supportive services. That's the kind of project which you would undoubtedly do very well in this competition. And again, to go back to that HUD emphasis on partnering with housing agencies and with healthcare agencies, what would really be nice is to see a new project which includes at least some beds provided by other, like, for example, Section 8, homeless preference beds, what we call DMV voucher beds, or we have the new homelessness, chronic homeless, well, there are the new vouchers that, so if we have a project which combines those with CoC funds and then also services provided by public health, then we have a great project that serves chronically homeless or serves dedicated plus. We would then get bonus points. We'd score higher. We'd get more projects funded. We would. So we're looking for that. But by the same token, we're also looking for rapid rehousing projects, to help people get into their own permanent housing. So, yeah.
Tony, we have a question.
Great.
From Lupe. The question is, we have the RRH funding, but the YHDP has the DV component. Would it be considered a new project or consolidation?
Wait, can you repeat that again? I couldn't quite.
Let me call Lupe too.
Yeah.
Lupe, could you just unmute yourself to ask?
Certainly, thank you. I'm not even sure if I'm asking the question correctly, because I haven't had the time to go over all of the material. It is a lot of material, but we do have the rapid rehousing funding, and then we have, of course, another year extended of the rapid rehousing funding. So my question is, looking at the YHDP, NOFO. I see in there the DV part. So this is separate from the rapid rehousing, correct?
Well, okay. So you have a renewal grant, which expires in 2022, right?
Yes,
And that's a rapid rehousing grant.
that is correct.
Yeah. So you're also looking now at the DV bonus as a new project, right?
Yes.
Yeah. So what you would do is you have to apply for renewal of your rapid rehousing as a renewal project. And that's not in the DV bonus competition. That's just a standard renewal now. But if you also want to submit a project for the DV bonus, a second project, you can do that. For it could be for rapid rehousing, it could be for transitional and rapid, or it could be, well, in your case, I don't think could be for coordinated entry. That would have to be the coordinated entry lead agency.
Okay.
Yeah. I think on that, yeah.
I think, yeah, that makes sense. So we actually have the two options then, is what I'm understanding, right? So we have the options of leaving our funding as is until 2022, and then applying separately for the DV. Am I getting that straight? I mean, no.
Yeah, well, your options are, okay, your first option is just to apply for a renewal grant for your existing program. That's option number one. The second option is to apply for your renewal and a DV bonus project, which could be to expand your current project. Maybe you want to expand it, add more people served.
Okay, that makes sense.
I mean, there are other options, like you could give up the grant, but we don't want to see you do that. So,
well, that's not an option.
Yeah, I mean, we are strongly encouraging
yeah,
agencies interested in serving a DV population to apply for the bonus to increase DV services in our community, which are critically needed. So if it would be nice to know if you are applying for the bonus and if other agencies would be interested in applying for the bonus. You don't actually have to be, a victim service provider to apply. You can be a regular homeless service agency who agrees to serve 100% DV. So we have some agencies in the community that could do that.
Thank you.
Yeah. Yeah, so we're definitely encouraging, a new DV housing project. We would love to see that, to expand the resources for that population. That will do well in the competition. It's important with that. It'll be important to write a really good application for the bonus because of the way HUD scores it. So, and I should point out that for if we do, we would have to work with you on the continuum of care narrative on the DV need and, and the experience of your agency, because that's included in the continuum of care narrative and is scored as part of that. So we would have to work hand in hand with you on that. So that's additional information besides the application that we'd be asking you for. And we did that with your grant writer the last time we did this. Any other questions?
Thank you, Tony.
You're welcome.
Thank you, Lupe. We do not have any questions in the chat box. Would you like to?
Tom has his hand up, Cheryl.
Sorry, Tom. Please go on.
Thank you, Robert. Hi, Cheryl. Hi, Tony.
Hi.
Question is related to timeline, since there is like quite a process and a delay between the applications and when projects are awarded.
Mm-hmm.
And I was scouring the different materials and couldn't see it. Do you know what their and I'm looking ahead to some of the housing development opportunities that we will have coming online someday. And so, the earliest that a new application or a replacement could start, and or the latest? Any kind of estimate on that?
Yeah, HUD has timeliness standards for projects that involve development. So the earliest would be, as soon as they make the grant. And let me, I think I have a section of my big document which includes the timeliness standards for new projects. Where is it? It's in here somewhere. Maybe I don't.
Page 22.
22.
Maybe.
Thank you.
Yeah.
All right. Yeah. Okay. Here you go. Yeah. So yeah,
Okay.
I mean, I think we're looking at a situation where you have to prove site control and the match in the environmental review and financial feasibility within 12 months of getting the award, or well, actually 24 months in the case of an acquisition, rehab, or new construction project. It's a question of which applies in your case.
Yeah, that's helpful, and I'll try to estimate.
Yeah, and so there's some more things here, and it's actually a fairly lenient policy. On the other hand, as a continuum of care policy, we don't want to see renewal or like new grant funding sitting around too long, because then we lose the potential to renew it for if you don't get started for like 3 years, then we can't renew it in years 1, 2, and 3. So so we encourage you to apply for these CoC funds for a construction project like that, when it's pretty close to when you're going to be building.
Noted. That's super helpful.
Yeah, or at least but I'm saying, if you can meet this timeline, you're eligible.
Okay. Thanks, Tom. Okay, Tony, I think we can go to the next item on the agenda,
Well,
which
thank
is
you
a
all.
special training.
Yeah. Thanks for all your questions. So our next item is, see if I can find where I am.
Tony, before we go on, can you
Yeah.
just repeat when things are due?
Okay. Things are due October. I should have it memorized. But I have a lot of things rolling around in my head. So
October 13th?
October 13th, yes. We expect to see your local applications and eSNAPs applications October 13th for all applicants. Okay, so the next item on the agenda is we're doing a special training on CoC match requirements. Now, we've actually heard from HUD that some agencies have had issues with match, so that's one reason we wanted to highlight how continuum of care match works. So, and this is a little training, and I'm not perfectly clear on what the issues are that HUD has seen, but they've had to do with documenting match and understanding the differences between cash match and in-kind match. So hopefully we can talk a bit about any of your examples if you can bring them up. Oops, clicked on the wrong thing there. Sorry. So I am going to scroll down to the next page. We're going to cover the match requirements. We're going to cover cash match, in-kind match, ineligible sources, and match record keeping. Can you all see this well? Is the print bold enough?
Yes.
Great. so the basic requirements, the CoC requires a 25% match of all awarded CoC funds, not including leasing funds. So that's $4 HUD dollars for every one of your dollars. It's on a per project basis, so you have to match each of your projects. And you can use cash match or in-kind match, and we'll talk a bit more about what those mean. An important thing with HUD match is that it can only be used for costs that would be eligible for CoC funds. So if you're paying for something that's not eligible for CoC funds, then it's not match. It might be leverage, which doesn't really matter anymore, but it's not match. It can come from private and public sources. So, HUD mentioned that some agencies had issues around how to calculate the match, like maybe you weren't coming up with enough match. You weren't calculating it properly. So we've got two examples here. Hopefully they're pretty simple. Example A is when you don't have leasing, and example B is when you have leasing. So with A, it's like rental assistance, 95,000, project admin, 5,000. So you're asking HUD for 100,000. So what's your match? It's 100,000 times 25% equals $25,000. That's what you're having to match. So, so your application should say that you're going to provide a $25,000 match, and your technical submissions should say the same. And you'll have to provide documentation to HUD that's what you're providing. I think when HUD says calculation of match, one of the issues that comes up is that when you do your technical submission after you get a grant, you may have received an FMR increase. So maybe your rental assistance went up to 100,000 instead of 95,000. So that would mean your total project request would now be, or total project award would now be 105,000. So your 25,000 is no longer enough. So when you've got to do a new calculation, you've got to calculate it again when you do your technical submission before you get your HUD grant award. It would be 100,000 plus 500,000 is, I can't do the math in my head, but it's like your match becomes like 26,000 or whatever it is. $26,287 or whatever. So, so that's how it works. When you have a leasing budget in your grant, you do the same thing, except you subtract the leasing funds. So here, you'd only need to match $60,000. So 60,000 times 25% is $15,000. Now, again, when you go to the technical submission phase, any FMR increase you get for leasing won't matter because it's not matched. But sometimes if you have an operations budget, HUD will increase your operation budget based upon the FMR. So again, you're going to have to recalculate your match at the time of the technical submission. Cash match, what is it? So it's actual cash that's spent on eligible program costs, and it has to pay for costs during the grant term that's being matched. So if you're applying for funds in 2023, it's a commitment to pay for costs in the grant year of 2023. And you can use public or private sources, but you have to make sure that the funds aren't prohibited to be used as match by the laws that govern the source. Apparently that's the case. I haven't actually seen any such sources, but some do prohibit their being used as match. So cash match eligible sources, private funds, local funds, state, federal funds, cash, any cash resources you have on hand in your bank, fundraising efforts, the cost of staff working on grant eligible activities who aren't paid by the CoC program, that's cash. You know, some examples of possible sources. You've got your federal sources. You know, I would say with like, this is a little tricky because with Medi-Cal or that one, it's only match if it's Medi-Cal funds that are committed to your program. It's not, you cannot use Medi-Cal benefits received by your clients as match because that's something they're getting, not your program. But if there's Medi-Cal billing for your program, which reimburses your HUD funded program for eligible cost, then that's match. Now with CalWORKs, like the housing support program, again, that's only match if CalWORKs housing resources are going to serve the clients in your program as part of your program. If they're just generally being used by your agency to serve whatever clients you have, they're not really matched for your program. And then I'd also like to highlight here program income. Many agencies now use, you know, if you have clients paying rent, the income you receive can be used as cash match. That's not something that's in the statute. It's been in HUD's appropriation every year. And until HUD changes that, they'll probably continue with it. Documentation for cash match. As many of you who have done renewals know, you have to supply written match commitment prior to grant execution. So that's what you upload when you do your grant application. And when you do your technical submission, I've been saying technical submission. What that is the second stage of your HUD application. The first stage is when you submit your project application, which has, you identify how much match you're going to have. And then the second stage is, okay, you got the grant. Now you submit a technical submission where you might have to make budget adjustments because of the FMRs, or HUD has found some issues, or they want some documentation of things. So you submit that thing, and they always ask for you to upload your written match commitment. And it has to be on agency letterhead. It has to be signed. It has to be dated by your authorized representative. It has to specify the amount of cash to be provided, and that's in line with the required match amount. The date the cash will be made available, the grant and fiscal year the match will be contributed, and the time period during which the funding will be available. And that has to be the time period of your grant. And then the allowable activities to be funded by the cash match. It has to, you know, clearly identify activities that if you paid for them with HUD funds, they would be eligible. So, and you know, in the past, I think we've had somewhere, I've had a, well, I don't have it here. We have a template for you to use. In-kind match, what's that? It's the value of property, equipment, goods, or services contributed to your CoC program. And it could be by you or your subrecipient or by a third party. And again, these in-kind things would have been, they have to have been eligible CoC costs if CoC funds had paid for them. Documenting, there are different documentation requirements for land, goods, and equipment versus services, which has a different format. So for documenting land, goods, and equipment, this is on agency letterhead signed and dated by the authorized representative. The date the land, goods, or equipment will be available, the grant and fiscal year, the time period, the allowable activities provided by the donation, and the value of the land, the goods, or the equipment. The value is one time only. You can't, if you're donating land to this project, you can't donate it to another project. Or it's just 1 year. I mean, if you donated this year, you cannot claim it again next year because it's a one-time thing. then documenting in-kind services is a little bit more problematic because it requires a written MOU between you and a third party that's providing the in-kind services. So this can be a two-step process. You can get a commitment letter from the third party in advance to be followed by a formal MOU once the HUD award is secured. So this is important because sometimes your third party doesn't want to commit in a written MOU before they know if your project's going to get funded. So if you get a commitment letter, and then, once you get the grant, then you do the formal MOU. So common in-kind services, mental health visits, medications, substance treatment, job training, pretty much anything in-kind that HUD funds could pay for. You have to figure out the value of the services at the standard rate consistent with the similar work in your labor market. And you need a system to document the value of the services during the year. And you have to periodically check in with the service provider. HUD recommends you do it quarterly regarding any changes to the services and rates. And this is because, over the course of the year, they may change their rates, or they may be serving more of your clients than they thought they would. So the value goes up and so on. So you need to keep track of that. And then the MOU requirement. So there is a written MOU, again, on letterhead, signed, dated, authorized rep. They want basic agency information, you and the service provider. They want to see a clear unconditional commitment to provide the services. And they want details on the scope of services, the name of the contract to be matched, the length of time, the contract term, the point in time number of clients that they expect to serve with the services, the total clients that will receive those in-kind services, the qualifications of the people providing the services, and the estimated value, which again, you have to track because over time it could change. And then any documentation requirements or, statement of the responsibilities of the providers and the timeliness standards. So that should all be in the MOU. Ineligible sources. So we've got ineligible cash sources, mainstream benefits that go to the client, not the agency. You cannot claim them. CoC funds. You cannot match a CoC grant with other CoC grant funds. But you can use other HUD funds like CDBG or HOME or many other HUD funding sources. Section 8. You can't match which is already designated to another project. You can't double dip. In other words, client savings do not count. I mean, some programs have a program for clients to save funds. Those savings don't count as cash match. And then any funding spent on CoC ineligible activities cannot be used as cash match. For the in-kind sources, volunteers, in-kind, if those volunteers would be doing the work anyway, and whether or not you had this program, you can't count them. But if you have a volunteer program specifically targeted to this program, then you can claim it. Any routine activities that a partner would provide even without the CoC program, to your clients, whether they're in the CoC program or not, that's not in kind. Potential or estimated services, what that means is there has to be a commitment. You can't just forecast that you're probably going to get these services. That won't do. And then any services that would not be eligible for CoC program costs. Record keeping. So in addition to providing HUD with a written, match commitment document or services MOU, you also have to do record keeping throughout the year. You have to track actual expenditures and the use of the match funds or the in-kind, through your normal financial tracking system. So, you're tracking this use of cash match through your financial statements, your general ledgers and other records, to show that the funds have actually been spent or the services have been provided to the eligible program, and their eligible expenses within the grant term. So you're creating a paper trail in case HUD audits you to be able to show that this was, fully qualified match. In-kind match, again, you're tracking the quantity and the value of the services and the actual dates on which the services are provided. So if you've got, you're going to want to track that in case HUD audits you. I should say about HUD audits for match record keeping, normally, if you make a mistake, HUD won't work with you to correct it. But if you don't provide match as required, then you will have to pay HUD. You will have to come up with a plan to provide the match. Or, and I have seen, I saw an agency many years ago, a large agency which didn't provide any match, and they had huge contract problems with HUD. So I just don't want to see any of you go into that. So it's important to correctly document your match. All right. So I think I'm done with this presentation. HUD has for additional resources, they've recently posted a virtual binder on match at the HUD Exchange. They have virtual binders with CoC and ESG virtual binders now, which are excellent resources. So with that, I think we have a couple of minutes on this match issue. Do we want to take questions on it, or do we want to move on?
Good idea to take questions if anyone has any. Okay.
Just Cheryl, I just have a comment. Part of why Tony went through this and the slides are available is that we have gotten, well, I'm going to say warning from HUD that they have concerns about our understanding about the match requirements as a community, which to me is a flare that they might be coming to look more closely. Mm-hmm. So they want us to take it more seriously than I think we have been taking it. And they have concerns about in reviewing the materials that are being sent in and our understanding of match kind of across the board. So I just want to say we all need to really take this seriously because as Tony said, just repeating it, that it can be a really big deal if you have to find 25% from some other funding source because you haven't thought about it ahead of time. So just want to emphasize it's dry and boring potentially, but it's not so dry and boring when you've got an audit and you've got to find a bunch of money that you don't have.
Lupe has a question. Thank you, Robert.
Lupe, I think a lot of the concerns that I think I was hearing and Tony checked is the in-kind match. I'm hearing that there's some skepticism about how we've been handling that. Cash, and I think not a lot of people are bringing cash, is my sense from just listening to HUD. So it's the in-kind where there's the MOUs and whether it's really in-kind for the program. I think those are areas where we're really vulnerable. Mm-hmm. And counting the same thing over and over again across multiple grants is an area where I think we are vulnerable.
So,
any other questions? And I think there are specific, Tony is really amazing at helping on the kind of individual level. So I don't think you all need to bring up your particular match questions on your grants now, but Tony is available to help sort through and answer them. But this is a year to try to get it straight.
Mhm.
And it's also a year we still have Tony helping us, so let's take advantage of his expertise. And are we on to YHDP, and am I supposed to talk about that next week?
I think I have a few people typing some comments. Tom is saying we used to do volunteer hours and then got TA 2 years ago. That got us to switch to cash match only. Is that okay? Tony, you want to talk more about that? Tom, sorry.
Oh, sorry. I was, having concentrated so intently, my attention finally relaxed a little bit. So, yeah.
I can comment on that because I was paying attention. Tom, number one, get TA, yes. Number two, cash match is safer if it's real cash match. So,
Yeah,
I feel like that's a lesson for all of us.
The problem with using volunteers, you can use volunteers, but with any of the in-kind tracking, actually getting your staff to track the in-kind match in a way that passes HUD muster is much harder than tracking cash. So that, I guess that's why you've gone to cash match. And if you're I would recommend, for any agency, if you have cash that you're committing to the project, use that as your cash match. I mean, use a cash match if you can, as opposed to services. You can still provide the services, but you won't, I mean, if you can still provide in-kind services, but if you don't have to use those in-kind services as the HUD required match, then that's a good thing for you. And that is because of the tracking requirements for in-kind services. It's just harder.
Okay. Thanks, Tony.
Yeah.
Okay, I do not see any more hands up or any questions in the chat box.
Actually, can I say one more thing about when HUD talked about our issues around in-kind match? One of the issues that they talked about, I think where agencies claiming in-kind match are using the same template for the MOU as they would use for cash match. And I think, with the elements that are required for a services in-kind MOU, that's not enough. So if you're going to provide a services, in-kind match, we should talk about the format of the MOU and don't just use the template that we have. So we can talk more about that. Okay, I'm done.
Just in time. I think we're good. We're good on time. We're good. I believe folks will definitely get back to us should they have any further questions or clarifications after reviewing the packet. So if you would like to move on, Robert will be taking up the next section. And this is a time where, like Tony mentioned, should there be any guests on here who are not who do not participate in the YHDP program, they can log off. That's correct.
Yeah, that's
Robert.
right.
Okay. And we just want to thank you all for spending time with us for those who might be logging off.
Great. And Robert, I just put up the document we have for this in case you want to refer to it, or if not, I can take it down.
I think it's great, Tony. So those of you that are still here, thank you. Wanted to make sure we talked about the Youth Homeless Demonstration Program overall and start getting people thinking about a few opportunities to help us have a more positive impact around preventing and ending homelessness for youth. So there are people on the call who were involved with helping our community secure this grant and the very early release of funds to focus on youth experiencing homelessness. And it's incredible that this community got those resources. And I think we're in a period of time with the creation of our new division where we have an opportunity to evaluate how well we're doing. And I'll say, as a fairly new person in the community, we have some interesting data points. We have a point in time count in the county that shows a very large number of youth experiencing homelessness. But in our coordinated entry system and in HMIS, we have very few youth who are touching our programs and our providers. So either the data from the point in time count of homelessness is not accurate, which is maybe partially true, or we're not doing a good job of finding and connecting with youth experiencing homelessness. So I actually think both of those things are probably true. And then the original set of grants that we secured, there are a lot of small grants that I think, from what I've heard from several providers, are really challenging to manage because they're so small. And so I think a couple of things. We have one organization that definitely wants to transfer their grant next year, and another that is open to transferring their grant, but we can't transfer grants in the middle of this process. But as a community, think about what is the best way to package this funding to get the greatest impact for youth. We should keep in mind we have one definite wants to give up their grant. It's a permanent supportive housing grant, which includes services and rental assistance. Another that's open to transferring a rapid rehousing subsidy and services grant. And then we have this opportunity through the NOFA, where if you are a recipient of YHDP funds already, you can propose transforming your grant and looking at replacing an activity to get it more in line with what's going to be impactful here in Santa Cruz County. And then the last thing I want to say, and then I wanted to open it up for discussion or questions. Next week, we also have a YHDP provider check-in where we're going to follow up on today's conversation and get into this maybe in a little bit more depth and get into more specifics. But we have a funding opportunity at the state. The California Office of Emergency Services has funding available to create some new resources for addressing homelessness among youth. And several organizations have expressed an interest in piecing together a funding application. So, and then last, I said one more thing. Then we have the state Project Home Key funds to potentially secure property that can be used for permanent supportive housing, affordable housing for youth. So we have all these opportunities to relook at how we're working together on this issue, and wanted to make sure, and this is the first day to introduce it and get all of our youth provider organizations really thinking about it. And from your perspective, what can we do to make some changes that are going to get a better impact on the issue? And Tony, do you want to, I know you covered this already, so maybe why don't we let people chime in and share their initial thoughts, and if there are any specific questions about how to change your YHDP program to something else, Tony can help us think through whether that's even possible. And my understanding of the principles are, within a single agency, you can make replacement decisions about moving from one kind of project to another. I think that creates some opportunities to move money around, potentially as well. And particularly if we can find a way to get the services funded from another source, as we've talked about a couple of times today. Like if there's a mental health program that works with youth experiencing homelessness and they can cover the services, can we change a grant here to get more money into housing to connect with that program? So those are the sorts of things that I'm hoping we as a community can reflect on, and we have a short amount of time to come up with some really creative ways to shift. So wondering if people have some thoughts or questions or ideas based on the work you've been doing around homelessness among young people. Pilar, go ahead.
So we have a shared housing, right? It started as host home, went to shared housing, and it's okay. It's a smaller grant. It's a smaller grant, but I guess I would be curious to actually hear from the group, or maybe some of the leads. I mean, is there something that you'd like to try in Santa Cruz County that we haven't done, or a new model? I think, and my colleague Laura's on this also. I mean, we're doing okay, but I mean, we might be open to doing something slightly different, not too different. But I'm curious, right? Like, that's why I wanted to be on here. I mean, I didn't know if there was something in particular you guys really wanted to try, or.
Yeah, and well, I'm interested in hearing from others. I'm going to reflect back what I've heard from staff at Bill Wilson and a couple of other people. During this pandemic, we started a youth sheltering program, and having a place that was youth focused, temporary housing, made the rapid rehousing and all the other resources. It just made it easier to stay in touch with youth and help them get on a path to something more permanent. And this community doesn't have any stable shelter or transitional housing for young people. So one of my fantasies is we can actually figure out, with all these different pieces, can we actually secure a property to have youth shelter or transitional housing that then makes it easier to bring people off an unsafe situation and help them get on a path to permanent housing?
So it was interesting because I did notice that, right? The transitional housing was one of the options in the kind of tweak on the YHDP, whereas if you were just applying for a new application, you have to combine it and have it be a TH to RRH.
Mhm. Yeah.
Would emergency shelter, just as emergency shelter, like limited, I didn't think that was one of the funding things. Yeah.
No, yeah, we couldn't use HUD money for that, but we could maybe use other state money that the youth set aside for shelter and then pair it with rapid rehousing, potentially. Let's see, Christy and then Tom.
No, actually, Tom's hand was
Tom
up
first.
first.
Okay, thank you, Cheryl.
Yeah.
Thanks. I'm not particular about the order. Wanted to first put out there that Housing Matters is who Robert was referring to with the rapid rehousing. So we are open to looking at other options for that. So I have a question on the process, since we can't change or move a project from one provider to another while the NOFA is happening, I guess and so, but if we had, so where would we rank? And I don't have an idea yet, but if we wanted to transform our rapid rehousing into something else, I think we have to talk about the prior, like, if we do that, then that takes away the option of then transferring it or combining some of the grants. So I think that's part of the conversation for us. And then just while you were talking about permanent housing or other, or purchasing options, I'm just putting out there that one of our neighbors here, one of the other homes on the block next to us, we got a call from a realtor this week asking if we wanted to buy it. And so we haven't returned the call yet. We don't know the details, but just putting out that there is a property possibly up for sale, unless it's just a realtor trying to find properties.
Right. Can I sort of follow up on a couple of things you mentioned there? One is that, just to clarify, I thought I heard you mention rank, and YHDP projects are not subject to competition this year. So your renewals, they will be funded, and your replacement projects will also be funded if you choose to move the funds from a replacement, funded non-competitively. They're taken out of the competition, but you do have to submit your application in eSNAPs. And of course, it still has its threshold review. So
I was kind of meant more generally as a community. If one of our goals is to move some projects around, but then a single agency, let's say Housing Matters, we say, no, we're gonna go another direction, then it kind of puts a wrench in whatever other plans were being made.
Well, hopefully you won't be going in another direction. You'll all be sitting down and talking and agreeing on the direction. But you can do what you want. One thing I would say, about the combining the projects now, that can't happen as part of the replacement or the renewal process. I mean, the only combining that could happen is if one agency had two YHDP, like projects of the same type, then they could submit it, combined grant. But we're not going to be able to. It's the way the replacement project thing is set up. It's one project can replace itself 1-to-1. That's it. And it's not like you can't take two projects and replace them with one. It doesn't work that way. I mean, the document that I had up a little while ago showed that. Do I have that up? How does it work here? It says, one YHDP renewal must be replaced under the regular CoC allocation. There can multiple renewal projects can be reallocated into one new project, but the YHDP replacement is a 1-to-1 replacement. So you can't do multiple projects into one. Only one renewal can be used for one YHDP replacement. It's kind of unfortunate, but that's what they're saying. So.
Okay.
Yeah.
Thanks, Tony. We have Christy.
Hi there. Hi. Thank
Hi,
you
we
so
can
much.
hear you.
Okay, good. I had to call in because I had pretty slow internet. So a few things here. I want to mention that with Encompass, we have our drop-in center YHDP grant, and we are also the sub-recipients for the new routes. And as we're kind of talking about different programs that are talking about possibly replacing or kind of transferring over, I'm assuming that that's one of those programs that we're talking about. I know that housing authorities. My question is kind of posed to you, Robert, I think. And so just kind of putting it out there, I would love to be part of those conversations if that is something that's being looked at, in terms of like what, if not that, what else, or, continuing to, seeing how we can continue to support that. One thing that, the other HUD grant that we hold is also our H4H3, which we serve, chronically homeless, doing housing navigation and case management. And historically, this is something that Encompass is very good at. We do really well with kind of a long-term supported case management and helping people in permanent supported housing. And so in terms of, as the subcontractor providing those navigation and long-term case management services to our new roots folks, it's something that we feel we've been doing a pretty good job on, and at the same time wondering if that's if that's the direction we want to go. I know that one of the things we struggle with in the community is again, it's like finding the youth, and we are using the coordinated entry system, and that does have some barriers and finding those youth. But then it's the next one is like then finding housing that is open to serving our youth. So we have all of those pieces. I wouldn't mind joining in those kind of think tanks if that's what's coming up. I would really appreciate that. And then just thinking about this idea of if not that, then what? And we're talking about transitional housing. And I just want to put out there that Encompass also had HEAP funding for emergency shelter for our youth, and we were putting that together, trying to put that together with our drop-in center as we were looking for a location. And the thing that has the biggest barrier that we faced in trying to open up this resource center was finding a landlord that would rent to us. And what we found was that was creating quite a stir, was this idea that we would have this kind of nighttime shelter, youth youth shelter a part of that. It got to the point where we ended up having to let that part go and hand that back. So just if we're thinking about, I just want to keep that in mind, is that if we're thinking about doing something like that, is like, I mean, the amount of struggle that we had trying to find somebody that will allow us to do that was incredible. There was so much political stuff and NIMBYism, and it was unbelievable. So I have a little, I'm a little worried about that part of, like, you know, transferring it to something like that, and then us having such a difficult time trying to find somewhere for that to go. So those were my thoughts around that.
Robert, you want to take that?
Yeah. Are you able to join the meeting next week? Did you get the invite, Christy, where we're gonna talk about this some more? If not, we should forward it to you. It's a YHDP provider meeting.
Yeah, I don't know if there's been well, since Christine Sippel left Encompass, and she was very involved with YHDP. So you're the replacement, so you should receive all notices, right?
Yeah, so
Okay.
I'm in that. I wasn't sure which one you were talking. I am in the YHDP partners meeting that's happening
Yeah,
at
okay,
10
great.
on Tuesday. Yeah, I'm there for that.
Yeah.
Yeah,
Right.
and I think that's been also just to kind of put that out there as a reminder that has been a big shift for us at Encompass, and I'm so glad I reached out to you when I did, Tony, because I did not know about this today. So there is kind of I am missing some important information, because I think a lot of stuff would be sent to Christine Sippel, who is kind of our lead with all things HAP and HUD grants.
Yeah, well, so we were spot on about the housing authority, that one grant. They feel like it's too small, that it has services money and subsidy money, and they don't want to keep managing it. It's more work than they want to handle. And there's my overall principle of wanting to move as much HUD money into subsidies as possible. And we also need to make sure there's appropriate services for people. So we've got to figure out who is an organization that can pick up managing subsidy payments. I think that's one big question for us, given we know that the Housing Authority doesn't want to do that anymore. And so that would require one of our, that's actually not for the NOFA, that's post NOFO, that we have to figure that out, like who's going to pick up subsidy management. And then I do keep wondering, because I'm a healthcare person, there's often such a disconnect between the Health and Human Services funding for services and the housing programs. Like, are we missing a chance to pair things up? Like, are there Bill Wilson Center or Encompass or CAB programs for youth that have the services funded but have no housing for the youth? Like, so that's a wondering. And then completely understand what you're saying about location, and I only heard the tail end of all the work that was done to just get the location you all are working on building out as a youth resource center. And I think if it's a smaller project, I mean, Tom gave an example of like a single family home that you're acquiring, or like in New Routes where you've got units embedded in a larger project where there's actually not a big public process, and because there doesn't need to be. That the rules allow for people to buy a property and have people renting it out, whether they were homeless before or not. So if we can find the right opportunity to secure a property and maybe piece things together, I'm talking generally because I actually don't have real specifics. If we are going to do something like a transitional housing program, that triggers other kind of planning and zoning expectations where we would need local, city, or county approval. Right now, the County Board of Supervisors seems to be ready to back a project in an unincorporated county. So if we could actually find a property in the unincorporated parts of the county that could work for youth that made sense for us, even though my impression is that's not where most homeless youth are residing, but that is where I think we could get policy support for a location, and it could be somewhere close to where there are more youth residing. But in terms of getting support for siting projects, there is strong direction given to us as staff to look for opportunities in the unincorporated area. So that's just another thing to keep in mind. And I think that having the resource center actually open hopefully will help with engagement, like having a youth-centered, safe space. But are there ways we can build off of that? And then I think having a place where people can sleep at night makes it a lot easier to help them with the longer-term plans to get them into housing. And I just feel like we're missing that. I don't have the answer, but wanted to put it out to everybody. Let's put our collective thinking caps on and see if there's an opportunity. And Tom, I don't know if you want to follow up with that real estate agent to see if it's real, but the home key opportunity is just posted on this. Governor Newsom announced it, and it's like money to acquire properties to help address homelessness. And there's a youth set aside, thanks to advocacy from some people on this call, probably a little bit more money for youth housing. So I'm just hopeful we can carpe diem this and find something that really will make a difference.
Thanks, Robert.
What is carpe diem?
Oh, seize the day.
Oh, right. That's right. Yes.
And I mean, the Bill Wilson Center, having been in multiple counties, I think there's probably some lessons to learn, like what in Santa Clara County, what are some of the things that have really helped improve outcomes that maybe we should be trying to move forward with here in Santa Cruz County?
Maybe this question's jumping the gun, but as the sort of coordinator of the process, I'd be curious to know who's actively considering a replacement project.
All right, I'll just chip in. We maybe,
yeah,
maybe, and maybe not. I don't know.
Yeah, a loose sense of actively thinking.
Yeah,
so,
and it's, I mean, I don't, I'm not saying it because there should be, but I mean, if you guys think there should be, then yeah, that's great. I mean, the original projects were well designed too, after an extensive process. But we've learned lessons since then that we've been talking about. So,
Tony, since Tom put out there, they have the rapid rehousing program. I mean, one thing I'm wondering about is if one group changes from one model to rapid rehousing, and then we have two rapid rehousing grants, separate agencies, but then in terms of transitioning the grant, then maybe we combine them as part of a strategy. So it seems to me in negotiating with HUD about a transfer, matching rapid rehousing and rapid rehousing together, this goes back to your original question, Tom. Well, if we went from rapid rehousing to TH rapid rehousing, and then later we tried to transfer to someone else, is that going to mess up the transfer? I think strategically having like grants where you could transfer increases the probability that HUD will approve of the transfer.
Yeah.
So that's an indirect way of kind of combining or scaling rapid rehousing.
Yeah, well.
All right, Claudia from FIT says FIT will follow up via email. Thank you. Well noted, Claudia.
Laura, were you going to say something about lessons learned?
No, I was actually just going to see if my colleague Laura was still on, because she's really the boots on the ground working with the client.
Yes, I am still on, and I've been thinking of a couple of things. So, from thinking about what we do in Santa Clara County versus how things have been going in Santa Cruz, I mean, one of the challenges that I know my staff has had is finding, so Bill Wilson Center started as shared housing, and then because of the pandemic, we were actually able to expand it where we were then able to offer young people a choice where they could go into shared housing or we could just do a direct rental for them out in the community, which for some of them, that was actually a better option and more appealing. But then finding those places has been challenging. Landlords don't want to sign W-9s when they're large corporations and there isn't a reason why a W-9 should be a barrier. Or the case manager is really having a hard time even getting like a foot in the door with some landlords. So I feel like there's I mean, one of the things I can say is that in Santa Clara County, you know, housing subsidy programs are pretty common, that the W-9 has really become much less of a barrier. I mean, it certainly was a barrier a couple of years ago. And so maybe, you know, just thinking about either size of community or just the more commonplace, maybe it's happening more often in Santa Clara County, and Santa Cruz just maybe isn't quite there yet. And so I do think that has been a challenge. Bill Wilson Center also runs HUD-funded transitional housing in Santa Clara County. And I do think, you know, if you can't fund shelter, I think funding transitional housing is a good option, because while sometimes a youth may not necessarily want shared housing, sort of with this community-based, you know, model where we're, you know, working with standalone homeowners usually who are renting out a room here or a room there, you know, sort of offering a young person shared housing where they would be living with other young people can maybe be more attractive, because they would be renting with other people maybe with similarities to them, rather than feeling like some of them did not like the idea of being like a guest in somebody else's house, right? And so, I mean, I do like the idea of transitional housing. I'm not sure as far as like what could be redesigned about. I mean, I guess there's a question about how much money, if there are other programs that people are looking to, you know, change to something else, like how much money is available for that. Because, I mean, I can just speak for like, I think the grant that we have, even if we were interested in transitioning it to transitional housing, I don't think the amount of money we get would sustain that. So, I mean, those aren't really anything definitive. Those are just some things that have been swirling around in my head about, you know, transitional housing could be a good option to give people a place to sleep at night while they get stable, and then maybe are able to transition on their own into something else.
Muted.
Robert, you're muted. Okay.
I was just thinking on the question, Laura, about learning from your experience could be helpful for the discussion. Maybe if you are willing to give us kind of a range of what you think, like a transitional housing bed in Santa Clara is costing us this, because we have I don't remember, Tony, $1.6 million YHDP funds, and then we have other state funds set aside for youth. So trying to get a sense of, you know, if we were to operate a transitional housing program, how much is that going to cost per unit per month in your experience? Mm-hmm. That could help us with the planning process, if you all are willing to share even just a range
Sure.
for us to think about.
I think we could probably do some math on that, don't you think?
And another issue, of course, is, you know, which model of transitional housing we're really talking about. I mean, that sounds like you know, how would you characterize it in Santa Clara County?
So the model that we're using right now is we typically rent single family homes, and then, you know, use the rooms to provide housing to young people. So for example, in a 5-bedroom house, we might be housing 6 young people, depending on size of bedrooms, number of bathrooms, various things like that. But that's typically how we do it. We also have one site where we have 3 3-bedroom apartments in one building. So it's easy for a case manager to sort of manage the clients, but they're in smaller sort of groupings.
Right.
That's how we've been doing it for, I don't know, 25, 30 years.
Yeah. Would you call it crisis residential or just plain transitional?
Just plain transitional housing. And so so then the other piece about that is we're following the traditional model when HUD used to regularly fund transitional housing. I mean, they still fund it. They just don't often let you do new transitional housing.
Yeah.
Where, you know, people could stay for 12 up to 24 months.
Yeah.
And, you know, really use that time to get stable, save money, and then frequently then leave transitional housing to their own rentals out in the community with their own money, not with a subsidy or anything like that. But there could be an argument for the joint component in that case too, right? Stabilization and transitional housing, and then
the THRRH type program. Yeah.
Of which we also have one of those in Santa Clara County.
Yes.
For youth, which has been doing okay.
And this, Tony, the crisis residential transitional housing, is this a new HUD thing?
No, I doubt it, but it's new to this program. So I'm not sure what they mean by it. I mean, this is the only verbiage that I've seen so far. Maybe if we look in the YHDP provider, you know, pages that they have, that HUD has, there may be discussion of crisis residential transitional housing, but I'm not familiar with it.
I was.
Hi, this is
yeah.
Sept. Can you guys hear me?
Yes, we can hear you. Can we know who's speaking, please?
This is Melissa Vieira from Families in Transition. I was having audio difficulties. Sorry.
Okay.
I just wanted to say that we're kind of looking at the potential of doing, you know, TH, maybe even a combination with RRH or PSH. It doesn't sound like we can necessarily combine with any other YHDP funding, you know, unless we have another YHDP grant with our agency, which we don't.
Mm-hmm.
So I don't know if we'd have enough funding available to do that, you know, with our rapid rehousing grant that we have.
Right.
We've done TH before, quite a bit. Actually, we even did shared clean and sober transitional housing for a while. But what we've done before is we've done it with master leases, with private market rentals, like Laura was saying. But usually if households that, you know, have additional barriers to housing, and if there is any way we could look at increasing partnerships with mental health, that would be fantastic and incredibly helpful.
I want to follow up on that, the mental health connection, because the director of adult and older adult mental health services is involved with a program, because a lot of mental illnesses start in the teenage years when people first start to have symptoms and first episode. So the county is looking at creating a new program for serving that population, but often they're unstably housed or family wants them out. So there might be a way to kind of pair up mental health services with that specific youth population. You said something, Lisa, that I think is worth maybe saying out loud. Like, because of the issues around siting, if people have a location that we just don't have the money to keep it running, we should all kind of like rally around a location that, either whether it's a long-term master lease with an owner that's comfortable or people who own property. I know you all made me think about it, but I think now's a good time to elevate those opportunities to the collective, because we could all, I think a lot of us have all struggled with the finding location issue. So if there are places where the thing that we need to build on something is the money, we could probably all convince each other to put some money into a location. So I heard you say maybe you all have some locations, so that's what triggered it.
Yeah, it's not own locations. We have some landlords that we've worked with for a long time that might be willing to do that. we have to have, more conversations with them. But it is possible. And some are in South County. Not sure about unincorporated or North County right now, although that is possible.
Yeah, and that's definitely worth talking to them. Either a leasing grant where we have an ongoing lease of the site or some other kind of arrangement. It's worth, if there are private property owners willing to do a partnership, we should explore it for sure. I know a lot of people have to hop off and we're over time. Pilar, some
Yeah,
thoughts?
our question, actually, I'm still on this whole, how do we pool money, right? And how do we put this together? So within our YHDP consortium, if somebody gave up their grant, does that money stay within the YHDP pool that other people could apply for, like as an expansion or something?
No, that won't happen. And we specifically want to avoid that happening. So, we don't want someone just to give up their grant because we will lose those funds.
Okay.
What we want them to do is to, apply for a renewal and then continue the conversation around transferring the grant through, the usual grant modification. I mean, HUD allows, agencies no longer want to work on a grant. HUD has a contract process for transferring a grant to another program. This happens all the time, and it can happen with YHDP as well, but just not through the application process. We have to wait until after.
Got it. Thank you.
Yeah, so that would be a possibility in terms of, enlarging a particular program or change, would be, to do a transfer after the fact and then next year combine them, it's like, so.
HUD
I guess I
doesn't
have
make it easy.
Yeah.
No, they never do. I did have one more question. We've talked a lot about other external sources, right? Like there is a CalOES one, there's the home key money. You guys put out something for ESG recently for rapid rehousing. Are you thinking about that at all as a tie-in to any of these youth programs?
Tony froze. Absolutely. Oh, no, you didn't freeze. Yeah.
I just didn't know how to respond.
Yeah.
Yeah. Yes. Yeah. I mean, there's a, you should look on the HAP webpage. There's the ESG request for applications.
Yeah,
have a look at that.
I saw. I just, it's coming out at the same time everything else is.
Yeah.
And like that one had a really high match on it, but.
Yeah, that's true.
Yeah, it's we all need to. I mean, I personally am open to like, how do we braid the right package of money together to create a successful project? Because the way that the funding is being delivered to all of us, it's usually not enough to get the program to really work. So we have to come together as a community to piece together ESG and HHAP and CalOES and HUD this and HomeKey to get stuff to really happen. So this was just the beginning of a conversation. We'll have more time next week to talk about it more, and people have the weekend to think about it, and including me. I actually have not. Part of what we'll have at the meeting next Tuesday is a little bit more data on what our programs are looking like, how many people are being served, and what's the data telling us, and then maybe that can help inform us around where we should be making some shifts. The thing that really strikes me is the big gap between the point in time count and the numbers who are in programs, in particular coordinated entry. So we don't have places where youth are getting connected and engaged.
Yeah, it's very hard to get referrals from coordinated entry for the YHDP.
Yeah.
Very. Yeah.
So we definitely have to do something about that.
I can't make it to the Tuesday YHDP meeting. Is there any chance it'll be recorded?
Yeah, we can ask people. Yes, I will ask people if they're comfortable with it, and I imagine that it'll be okay with folks. So we could send it to you afterwards.
I would really appreciate that, and I'll talk to Claudia. She's the project manager for our YHDP program. About some of this. She was in on the call. She had to step away with the client. But I'll talk to Claudia about some of this. I'm not sure if there's parts I still quite understand, but I'll go through the NOFO a little more too, and appreciate that very much.
Well, thank you all for sticking with us through this whole session and taking the time to start the brainstorming process for this YHDP opportunity. To be continued next week.
Okay.
Thank you all. Have a wonderful
you.
day.
Bye-bye.
Yeah, thank you.
Thank you, everyone.
Bye,
Happy weekend.
everyone.